My name is Alexis, and I'm a nurse whose passion is to empower you with knowledge of natural health solutions so that you can obtain the kind of healing you're looking for.
What is functional medicine? Well, functional medicine is a branch of Western medicine, what most of us are used to, where the practitioners are trained into diving into the root cause of the illness, and they use a combination of lifestyle, environmental, and supplement type therapies. Who practices functional medicine? Well, it's MDs, DOs, nurse practitioners, PAs who've all gone through some kind of extra training on how to dive deeper into lab tests, how to test for certain things that regular conventional doctors are probably not going to look for. They're going to have narrower lab value ranges, and they're going to use a lot of dietary and lifestyle practices in their recommendations. So the main therapies that functional medicine practitioners are going to use are going to be lifestyle and dietary therapies. They do a lot of health coaching. A lot of times you get paired up with a health coach who is going to walk you through your habits, your diet, how you can improve all of those things. They will use things like hydrotherapy, detox protocols, stress management. They'll use a lot of supplements and some herbs. What does a typical appointment with a functional med doctor look like? Well, usually you get to spend about an hour with the practitioner who is going to give you their undivided attention. That is one of the ways in which functional medicine shines, is they spend a lot of time with their patients. And the provider is going to go into an in-depth medical history with you, starting all the way from your mother's health before you were conceived. And then they're going to give you lots of suggestions for further testing, such as labs, that's most common. And then they're going to start compiling a treatment plan for you, probably throw out some ideas for the treatment plan as to, like, do you think that this would work for you? Is this something that you're willing to do, etc. And then after your appointment is when they will finish compiling the whole plan and will send it to you. Do these providers take insurance? Well, yes and no. They are able to use insurance to bill for your labs. However, as far as the cost of seeing the provider themselves, the answer is no, and that's because insurance companies just aren't set up for paying providers that spend that much time with their patients. A couple of the downsides of functional medicine would be, one is that it is still a fairly new realm within Western medicine. So the field is growing. There's a lot of research to back it up, of course, and more research is coming out all the time. It's getting very popular, but it is still new. And then also another weakness would be the price of an initial appointment with a functional medicine practitioner can be very high, and that can be overwhelming to some patients. Some of the areas that functional medicine is particularly strong in would be, one, the fact that it is so well recognized by conventional Western medicine doctors in general. So that does make it easier to work with your other doctors that you're probably having to see for your chronic conditions. And the communication between doctors is easier. They also do a really great job at doing in-depth lab work, like I was saying earlier. So they look for things in labs that other doctors don't look for, and they also have a much narrower range of values that they want to see. Overall, functional medicine is an incredible tool. It's an incredible field. I highly recommend it to most everyone. It can really help you clean up your diet and your lifestyle and help you recognize how you need to be taking care of yourself and give you the therapies and the tools in order to do so. Don't forget to like and subscribe. Do it for Oakley.